I think I want to start off by saying homelessness and rough sleeping, in many respects, typifies what I would refer to as system failure. In many respects, homelessness and rough sleeping is a consequence of what I would argue to be a failing system. And just to give you some idea of what I mean by that and give you a bit of a Greater Manchester context, at the moment we have 84,000 people on our housing waiting lists across the 10 local authority within Greater Manchester. For every 10 homes recently sold off under the right to buy, we've only been replacing them with one over recent years. And that one that we've often replaced it with has not always been at a social rent. We live in a world where unemployment might be coming down, but the nature of the labour market is increasingly precarious. The number of people on part-time employment who want full-time hours, the number of people on zero-hour contracts, those in low pay, low skills, and also those who are having to hold down 2 or 3 jobs just to make ends meet. In addition to that, household debt, personal debt, is at an all-time high within this country, and we've had the chronic undersupply of council housing and social housing over many, many years. At the moment, within Greater Manchester, we're really struggling with low turnover levels within our registered provider stock. That obviously is creating problems when we're looking to move people who are suffering from homelessness and rough sleeping into housing. In addition to that, there's the obvious, which is local government cuts. By the end of this next financial year, the City Council that I'm the Mayor of will have seen its budget cut by over 50%. Over 50% of our money will have gone as a consequence of budget pressures and direct reductions to the revenue support grant from central government, forcing people within that organisation to work even harder than ever just to provide services within the city of Salford. Then in addition to that, we hear more recently that the private landlords are pulling out of the social housing market. Last year, I think 30,000 homes were lost nationally because private landlords have taken a decision to not offer homes to people on benefits because they were worried about the rollout of universal credit and the 5-week wait that people now have to wait to receive their income. So when we talk about homelessness and rough sleeping, I think it's really important that we contextualise it within what I would refer to as system failure. So thanks very much for obviously inviting me here today, but also one of the things I like to do is reflect on history a little bit. Not to be nostalgic or to live in the past, but certainly to learn from it. And amongst the most significant of appointments when the Labour government swept to power in 1945 under the new Prime Minister Clement Attlee was Aneurin Bevan. And what was interesting about his portfolio was he was the Minister for Health and Housing. And when we talk today about multidisciplinary approaches as a way of tackling homelessness and rough sleeping, I guess what I'd say to this audience is this is nothing new. It really isn't. And from the slums of the 1930s, the connection between health and housing was clear for the Labour government at the time. Poor housing conditions, damp, mould, cold and poor sanitation, along with overcrowding, were a clear source of many health issues plaguing the healthcare system at that time. Good quality homes ushered in a new era of unprecedented health improvements in the United Kingdom, along with the universal provision of healthcare provided by our much-loved National Health Service. From respiratory problems to the spread of diseases through overcrowding, poverty and poor housing conditions were the source of a host of healthcare problems plaguing pre-war Britain. The connection between housing and health is as pertinent today as it was back then. But somehow modern government has lost, in my opinion, some of the wisdom of its post-war ancestor. Perhaps it's been a halcyon era of consistent improvements in living conditions, improvements in medicine, and the drastic reductions in poverty over recent years. Perhaps prosperity, growth, has somehow allowed us to forget the benefits which a comfortable, warm, and secure home actually gives us. Yet somehow, over recent years, we have seemed to have forgotten the systems thinking of the past when it comes to policy, with health and housing often operating along parallel lines and not actually meeting in the middle. Where have we potentially advanced beyond, I would argue, the post-war Labour government is in our understanding and acceptance that mental health-related issues are actually connected to housing. A good home is not just a home that will make you well and prevent you from illness. It's a place of comfort. It's a place of warmth. It's a place of security. Some of these things are not actually tangible. We can't measure them despite our desperate desire to often measure things. A good home provides a sense of place, a sense of stability, and ultimately a good home is a fundamental human right. A home is a natural and essential aspect of a person's mental well-being. It's therefore no surprise that homelessness and rough sleeping often presents a vicious circle of mental health issues for those unfortunate to find themselves without a place to call home. Mental health problems are both a cause and a consequence of homelessness. Prevention can ultimately save us as a society many millions of pounds. Currently in local government, we're being told that we're spending over £1 billion nationally in temporary accommodation. Going back to the point I made about budget pressures, temporary accommodation doesn't really feature within the government's revenue support calculation. It forms a budget pressure year on year for local authorities. So to meet that need, we have to cut more jobs and services within the council. Not to mention the benefits of ultimately avoiding unnecessary human misery. Entrenched rough sleeping, in particular, costs the health service significantly, particularly in relation to A&E admissions, and those with poor health regularly display negative and self-destructive habits and behaviour, which commonly manifest themselves in increased demands for the National Health Service, from smoking to alcoholism to the use of illicit substances like the use of spice, to violent confrontations also on our street. A life on the street takes its toll on both the body and the mind. We've already heard as well that as a result, the average death of people sleeping on our streets is in their mid-40s. This is ultimately a scandal and will cost us all dearly. But often, the immediate alternative, being temporary accommodation, also negatively affects health and well-being, particularly for families and the elderly. Where children are involved, this has an intergenerational impact, something, again, we can't measure in the short term. Reconnecting health and homelessness will be critical to improving the life chances of people and also improving their mental and physical resilience. That's why in Greater Manchester, we're including health and homelessness as a trailblazer, and why health and social care have made important commitments around homelessness and rough sleeping. Our work on developing an integrated health system in Greater Manchester has helped significantly in facilitating conversations, operating as one system, and merging resources necessary for collaborations between NHS foundation trusts, clinical commissioning groups, local authorities, mental health NHS Foundation trusts, and also working very closely with the community and voluntary and social enterprise sector across Greater Manchester. Our ambition is that health and social care is centrally involved in our prevention agenda, making long-term savings for health budgets. We're also reviewing our hospital discharge protocols to ensure that these are fit for purpose and not a contributory factor to the downward spiral of poor health, addiction, and hospital readmission. The Mayor of Greater Manchester, Andy Burnham, has gone beyond the government's pledge to end rough sleeping by 2027, and he wants to end rough sleeping by 2020 for the people of Greater Manchester. Our rough sleeping and homelessness strategies in Greater Manchester have also been co-produced with residents that have either been rough sleepers themselves or homeless or at risk of being homeless. And we're well underway with rolling out our social impact bond work with our registered providers in the city to provide that additional support. We've also been successful in downloading monies from government in the autumn budget to roll out Housing First, when we're looking at probably 3 schemes across the city region. I agree with the comments made earlier. We do not need a pilot or pilots of Housing First. We just need to get on with it. We know what needs to be done. In terms of the new duties within the Homelessness Reduction Act, we've been training and coordinating across the 10 local authorities, making sure all of our housing options teams are up to speed with the new legislation. And although I accept the model of prevention, rapid response and sustained support, what I would say is delivering that model, certainly for Salford Council, on a budget of £61,000 in terms of the additional cash we got from government is very, very challenging. And also to locate that within a context of, by the end of this next financial year, the City of Salford will have had 50% of its budget taken away from it. It's really interesting how we devolve responsibility, but not necessarily resources to deliver on some of our legislative ambitions. So prevention, I believe, will continue to be very much a challenge within that model. I think we'll probably do rapid response and sustained support for those with complex needs reasonably well, but to actually invest in that prevention work is always going to be a challenge in a climate of austerity and cuts. So for me, integration obviously poses opportunities, challenges, but also problems. And in the case of homelessness and rough sleeping, it has enabled us in Greater Manchester to take a much more strategic approach towards working collaboratively and together across all these areas of public service. This, in my opinion, can only be a good thing in relation to seeking to end homelessness and rough sleeping within Greater Manchester by 2020. But it's also a challenging time in which to play a role in devolution in Greater Manchester. Devolution, from my perspective, in many respects, means devolving resources, but not enough resources to actually meet those responsibilities. And we need to go much further to get true devolution and true local determination of what we do with public money in this country. Thank you very much.